right. Well, I will try to give you a short talk about herd closure. I described the whole strategy and actually also that we have these models that we are running and we believe in it. I will just give it a short description on how we actually are performing this herd closure. Like I said, we are not doing anything special. We're just implementing the plans that have already been described. Like I said, when we stabilize our sow herds in Denmark, we have adapted the recommendation described from the US by ASV. We use the load, close, and homogenize model that's been run in most of the farms. 80% of our sow herds being eliminated of PRRS is using the LCH method. The last 20% is doing total depopulation. We close the herd for 210 days, and then we do a max vaccination with MLV vaccines, either type 1 or type 2. Very important, we do not use LVIs in Denmark. It's not legal, it's not being used, and it's not being recommended. We only use registered MLV vaccines for this homogenization. We implement the McRebel procedures in the farrowing unit, or the 10 golden rules. That's also a common thing to do. And then we start surveying the status of PRRS in the sow herd after the homogenization, either by processing fluids, tongue tips, oral fluids, or whatever works in that farm. Nothing fancy. So what we do when we are preparing for this load, close, and homogenize, PRRS infection can be dynamic in the herd and should be investigated by taking samples in the different housing systems and unit and other properties. And then you have to carefully review the herd's external and internal biosecurity. So it's not enough just doing the vaccination and the closure. You also have to be aware how are you actually performing with your biosecurity, especially external biosecurity. We have rules in Denmark with our SPF system, so we're quite good shape, but you have to be aware not to introduce anything to your farm at the same time. And of course, you have to be aware what you're doing internally. I recommend you use this Combat app. It's a very nice app developed by Boehringer. A lot of good information in that app so can help you achieve a better biosecurity in the specific herd. Then when you get to the point of loading, we recommend that you load the herd for production of gilts for at least 200 days. Maybe some areas of the world you need to have a longer period due to the period for going to stability is longer. I reckon that some of the variants is more hard to get control on. But in Denmark, we are pretty good shape using this 200 days recommendation still. It can be limited to two different properties if space is limited, but you just have to make sure that the property that you are using for gilts should be in an area where you don't have the risk of being introduced of PRRS in the neighborhood. If the gilts down to 4 weeks of age cannot be handled, a period without introduction of gilts can be necessary, and thereby you have to tell the farmer that you have going to have a period for a lower production because you cannot replace the sows at the rate that you're used to. And then you have to close your farm, and you really have to close it, and you have to be aware that it can be hard times, but to gain control, you need to close this herd. 210 days is our recommendation still. Sometimes you have to do it a longer time, depending on when you're monitoring the herd and you don't achieve stability, then you have to keep on going. But most of them, 210 days is still good. Like I said, focus on external and internal biosecurity at the same time. You're not safe. You really have to be careful what you're doing. And then you have to stick to these 10 management rules or McRebel rules as described earlier. And then when you homogenize, achieving uniform immunity by whole herd mass vaccination of all sow herds, gilts, and boars twice with 28 days. We use MLV vaccines. We do not use LVI, but we recommend doing this. Most of the farms are doing this. I'm not saying it's not possible to achieve control without using it, but if you use MLV vaccines, you can be sure that you're on the same page of immunity for your sows, and thereby there's a higher chance you can get to a stability for a shorter period. Here's some recommendations for our test strategies. It could be, we can discuss this, and probably there would be variance between the farms, but this is just an overall recommendation on how to do it. We recommend that you wait at least 3 months after the first mass vaccination before start testing. Some of the farms is doing it early on because they're eager to find out what's going on and they're really pushing it. But we're trying to recommend to wait. But when you do that, you can start testing every week for processing fluids in your farrowing unit to see, do you actually achieve weaning, birth of negative piglets? You have to test them. Maybe you have to look for a long time. And not before you have 4 rounds of negative samples, you can move on to the next step. And that's the hard one, because we're always discussing this when farmers and veterinarians start talking about, well, now we're there. There's no virus in our farrowing unit. You ask them how many times you tested it. Did you reach 4 times, or is it just 1 sample? Usually they're a bit fast on that, but that's a key thing. Then we have to test for stability before and after weaning. We can do that by blood sampling. You can do that by testing femoral oral fluids in farrowing unit, or you can do that by testing oral fluids at pigs weaned right after weaning. Again, you have to test this several times to make sure that you actually are weaning negative piglets, and there can be variants. There are people here in the audience that know a lot more about that than me, but I know this one here is also a key thing, that sometimes farmers is a bit too fast saying, now we are weaning negative piglets, and then you get a positive sample next week. Because at that time you have to make a decision, now you're going for elimination or you're going for control. Here in Denmark, a lot of them are going for elimination, meaning now we're actually going to put in sentinels, now we're actually going to run the sow herd naive. And if you're not testing enough, you could still have virus in your farrowing unit or somewhere else, then you will have clinical signs and trouble again because you really didn't get to control before you start putting in sentinels. Again, more samples need to be taken, and actually also patient time is important here. And farmers is always impatient, they just want to move on. We are already there, there's no clinical sign, put in the sentinels. We see some failures there. So, just to try to sum it up a bit, how to put this timeline on this herd closure. You load the gills, and you homogenize with and then you do it again 3 weeks later, second mass vaccination. Then you wait for 5 weeks, start vaccinating piglets if that's necessary. We do that in certain cases. It's not all of them being vaccinated. Some of them you need to vaccinate the weaners as well, depending on the structure of your farm, depending on the flow of your pigs. Then you have to implement the 10 golden rules or the McRebel procedures. Again, that's a very key thing. Veterinarians spend a lot of time trying to make sure that this is actually followed. And to be honest, it's difficult to do that for a long period of time. When you have, in Denmark, large litter size, you have a lot of pigs in this farrowing unit, you have to put down a lot of pigs doing this because you're not allowed to do the cross-fostering and all that. So it's not easy to be done. So when you implement them, you have to make sure to do it in a short period as possible. And then at week 29, you insert your sentinels, and if they're negative, then they will get a negative status. Yeah, I just have to make sure. How much left? I'm on time, right? So, like I said, the key thing is actually to get your staff ready for doing this when we have to implement these management rules in the farm. And you have to do it every day, every time you handle these pigs, you have to be aware of it. So training your staff is very important. And usually, just to be aware that people is actually making a mistake is difficult, because if the people don't know they're making a mistake, they won't tell you. You have to see it. I had a discussion with Clayton about that. It's not easy to actually to see what's going on. You can just see your samples still coming in positive, then something's not right out there in the farm. But actually, to pinpoint the problem could be very difficult. So be aware of all your the clothing and all the things that you're using in your farm. Make sure you don't have the risk of introducing anything between the different litters because of dirty material and stuff like that. And like I said, high litter size is very difficult for farmers to kill these animals but you have to put down some of the diseased animals to make sure they don't infect a lot of other ones. You also, sometimes we recommend you have to reduce the number of sows to make room in your facility to actually achieve some of this PRRS control. Again, very difficult for farmers to actually reduce the production for a period just for PRRS control. Milking facilities, we have a lot of adding milk system in Denmark because we have this high litter size. We look a lot at that, we look into that, about the hygiene and the risk of infections in that system. Yeah, and of course, no feedback is allowed here. Yeah, so, and I already said this, we have this loading the gills, we close the herd, and then we expose the herd to MLV vaccines. And then when you get to the point of decision what to do, you need to control PRRS or do you want to eliminate. But the procedure until that point is the same procedure. We do it every time, and we are just choosing status number 4 in Denmark, going for elimination. And that was 10 minutes again. So thank you.